recording. Okay, so today we would be talking about coronary circulation. Now, we know that the major organ in the body that pumps blood to all other organs is the heart. And without the heart, no organ in the human body would receive blood supply. And without blood supply to the organs of the body, they cannot function and they would eventually begin to die without blood supply. So if the heart is pumping blood to all other organs, what about the heart itself? The heart is also an organ, and that means the heart also needs blood. Even though the heart is the pumping machine that takes blood, supplies blood to all other organs, the heart needs blood because it's working. You know, it needs energy it needs nutrients to be able to function. And so where does the heart get that blood supply from? Now, for the heart to function, there is what we call the coronary circulation. So the coronary circulation is simply the blood supply to the heart. And the coronary circulation begins in the aorta or the left ventricle, where you have the aorta leaving the left ventricle. And then you have coronary arteries, which move the blood from the aorta or the left ventricle down to the myocardium. That is, the myocardium is the muscle of the heart, because it is the muscles of the heart that contract for the heart to be able to pump blood, out into, to other organs of the body. So blood leaves the aorta, and the blood that is leaving the heart, when the heart pumps blood, that blood leaves the heart majorly through the aorta. We're talking about oxygenated blood. It leaves the heart through the aorta. But that blood does not only just go to the other organs, it also goes back to the heart. That is why we see here that we have the left ventricle and the aorta, and then we have coronary arteries taking blood back to the heart, but this time around to the myocardium, to the muscles of the heart. And so the muscles of the heart use this blood, and that blood becomes deoxygenated blood. The blood has to be returned, to the heart, but this time around it will be carried by what we call the cardiac veins. So the cardiac veins return the blood to the heart, but this time it is not going to the aorta, it is going to the right atrium. Remember that when we talk about systemic circulation, we said blood returns back to the heart and enters the right atrium. So the vena cava takes the blood to the right atrium. So all the oxygenated blood return to the heart through the right atrium. The same thing happens with the coronary circulation. The cardiac veins take the blood from the myocardium of the heart and returns it to the right atrium. So coronary circulation simply means the supply of blood from to the heart from the aorta and back to the right atrium. So coronary circulation begins in the left ventricle and ends in the right atrium. Now, so this picture here shows you the main arteries or the coronary arteries that actually supply the heart. And here you would see The first one, ROCA, this is the right coronary artery. So on the right side, we have a coronary artery called the right coronary artery. And on the left side, we have the left coronary artery. And then here you see sinoatrial nodal artery. So we have what we call the SA node, sinoatrial node, which you will discuss later when we are talking about the electrical activity of the heart in physiology. You will see that there is a node called the SA node, which is the primary pacemaker of the heart. So that SA node receives blood supply also, but that blood supply is coming from, you see the right coronary artery is the main one. So this is just a little branch that is coming to the SA node. And then the right coronary artery comes down here, and then it forms a marginal branch. So we have a right marginal artery. And then on the left side, we have the left coronary artery, on the left side, originating from the left side of this aorta. This is the beginning of the aorta. Now we have here the left coronary artery, and then it gives off a branch, a circumflex branch, which is called the left circumflex artery. So this is a circumflex artery that is going posterior, to the back of the heart. Then here we'll have a little branch on this one, which is called the left marginal artery, but we're going to look at a data diagram. And then the main branch from this left coronary artery, you have this left anterior descending artery, LAD. It is left anterior and it is descending, LAT. And then you have the posterior descending artery also. Now, let's look at other slides to better explain the coronary circulation. So the coronary circulation of the heart is a circulation of blood in the blood vessels of the heart, that is the myocardium. So it is the muscle of the heart that needs the blood to function. So coronary circulation simply means blood circulation to the myocardium or to the muscles of the heart. Now the coronary circulation consists of coronary arteries and cardiac veins. So here, this slide says it is coronary veins, but you could call them cardiac veins also. So we have coronary artery and cardiac veins. And in this picture, you will see two diagrams, one showing the coronary arteries and the other one showing the cardiac veins, okay? Now, I'm going to explain in the next slide each of the branches of the coronary artery and what parts of the heart they supply. But let's just look at this diagram. Let's follow the labeling of this diagram. So here we have the aorta here. This is the aorta, okay? Now, just at the beginning of the aorta, you have your right coronary artery originating on the right side. And then on the left side of that aorta, the beginning of the aorta, you have the left coronary artery here, originating here. Now, this right coronary artery comes down and then gives off different branches. This diagram doesn't show all of the branches. It only shows the major branches. So you see the right coronary artery gave off this branch, which is called the marginal artery, the marginal artery. And then the left coronary artery here gives off the circumflex artery, which is going posteriorly. The fainted lines are showing the posterior parts, okay? So when you look at this, you see that this red color is thicker or brighter than the one behind. So these faint lines are showing the back or the posterior aspect of the heart. So the circumflex artery goes to the posterior aspect of the heart. And then you have this one that is coming down here, which we said it is called the left anterior descending. Now it has two names, okay? This particular one has two names. Either you call it the anterior interventricular artery, or you call it the left anterior descending artery. So don't forget that. Anywhere you see anterior interventricular artery, it is the same thing as the left descending, the left anterior Descending Artery. That's another name for it. Now, you would see that there is anastomosis. So anastomosis is just a junction, between blood vessels. So when blood vessels come together to form a junction or a connection, you have what is called an anastomosis. So here, you see this diagram is showing anastomosis between the branch of this artery. See the circumflex artery, you see a branch of it comes here to join a branch of this right coronary artery that came here. So this is an anastomosis, okay? The combination of blood vessels from different origin. So here you have the left, sorry, 1 minute. Yeah. So here, this is left coronary artery, a branch of it coming to anastomose with a branch of the right coronary artery. That is what we call an anastomosis.
So the combination of
a combination of blood vessels or a junction connection between two or more blood vessels is called anastomosis. The junction or the connection between two or more blood vessels is called anastomosis. Anastomosis.
Okay, sir.
Good. So the main coronary arteries are the right coronary artery and the left coronary artery. And then each of them gives off branches, which we would look at later and where they supply. Good. Now, on the right side here, you will find, on the left side here, you will find the coronary veins or the cardiac veins. And these cardiac veins, they drain blood from the heart. So the arteries, coronary arteries supply blood to the heart, while the cardiac veins drain blood from the heart. So here you have the main one, which we call the great cardiac vein. And then you have the anterior cardiac vein. This one coming down here is called the anterior cardiac vein. So this one coming down here, this anterior cardiac vein, is equivalent to this one. We said that it is the left anterior descending artery. So it runs alongside this one. So the arteries and the veins are running parallel, close to each other. And then we have on this side what we call the small cardiac vein. So this is the small cardiac vein. And then we have the coronary sinus here, which is like a vein that is taking blood also from a particular part of the heart. That vein is called like a sinus where blood is drained from. So that is called the coronary sinus here. And then you have the middle cardiac vein. Now, all of these veins are going to drain back into, where are they going to drain to? We said from the previous diagram that cardiac veins will return blood to the right atrium at the junction of the superior vena cava. So they are going to drain back to this right atrium at the junction of the superior vena cava. But we'll look at each of them. So let's start with coronary artery. So we said that there are two main coronary arteries, the left and the right coronary arteries. And both of them arise from the base of the aorta or the beginning of the aorta, and they encircle the heart in the coronary sulcus. So the left and right coronary arteries arise from the base of the aorta. So they are going to ask you an exam, where does the right and left coronary artery arise from? So you could say they arise from the base of the aorta, and they encircle the heart in the coronary sulcus. So they're like a gutter there where the blood vessels pass, run through. That is called the coronary sulcus. Now, what do the coronary arteries do? They provide the arterial supply of the coronary circulation. So we said the coronary circulation has both arterial supply and venous drainage. So these coronary arteries, they are the ones that provide the arterial supply of the coronary circulation. Now, the left coronary artery runs towards the left side of the heart, which I showed you in the previous diagram, the left coronary artery runs toward the left side of the heart and then divides into two major branches. Now, what are the two major branches? They are the anterior interventricular artery, which is also known as the left anterior descending artery, LAD. Okay, and this LAD follows the anterior interventricular sulcus. So there is an interventricular sulcus. Between the two ventricles of the heart, there is a sulcus, like a gutter where the blood passes. Let me take you back to this diagram. So if you look at you won't find it here, but this blood vessel you see here, this one that is called anterior interventricular artery, is running inside the sulcus. So there is a gutter where the blood vessel runs through. That gutter is called the interventricular sulcus, and it is the sulcus that runs between the two ventricles of the heart. So the left coronary artery originates from the left side, okay, at the base of the aorta. Good. Now, it runs through the anterior interventricular sulcus, and what does it do? It supplies blood to the interventricular septum and the anterior walls of both ventricles. So remember that this anterior interventricular artery is supplying blood to the interventricular septum. So the septum is like the separation between the two ventricles, that's the septum. Now that interventricular septum is supplied by the anterior interventricular artery, and that artery also supplies the anterior wall of both ventricles. So here, you have on this side the right ventricle, and you have on this side the left ventricle. So blood supply to the right ventricle and the left ventricle anteriorly in front, okay, is done by this particular artery here that we said is called anterior interventricular artery, or the left anterior descending artery, which is another name for it. Good. Now, the circumflex artery, which I showed you in the diagram, supplies the left atrium and the posterior walls of the left ventricle. Remember, I told you that the circumflex artery, this one here, is running posteriorly. That is why you see that the color of the red here is kind of faint, because it is running posteriorly. Even though it originated from this place, from the left coronary artery. So this is the left coronary artery. So it gave a branch which is called the circumflex artery. So this circumflex artery is running posteriorly to supply the posterior wall of the left ventricle and also supply the left atrium. Because here, this is the left atrium. Here, this is the left atrium on the left side. Okay, and then the left ventricle has a posterior wall, and blood needs to get to that posterior wall. So that is why the circumflex artery also goes backward to supply that part of the heart. So the left atrium and the posterior wall of the left ventricle. But the anterior wall of both ventricles are supplied by this anterior interventricular artery, while the posterior wall of the left ventricle alone, okay, is supplied by the circumflex artery. Now, these are the two main branches of the left coronary artery. So the anterior interventricular artery and the circumflex artery. Now let's look at the right coronary artery. The right coronary artery courses to the right side of the heart, where it also gives rise to two branches. What are the two branches? The right marginal artery and the posterior interventricular artery. So right coronary artery has two main branches: the right marginal artery, which supplies the myocardium on the lateral side of the heart. So here you would see the right marginal artery. So this is the marginal artery supplying the lateral part of the heart, and it is coming from the right coronary artery. So this is the branch. This is the marginal artery here, coming from the right coronary artery. And then the second branch that came from this right coronary artery is running posteriorly, which is this one, with a faint line. So it's supplying the posterior part of the right ventricle. The posterior part of the right ventricle is supplied by the posterior interventricular artery, which is a branch of the right coronary artery. So two main branches, right coronary artery, two main branches. One that goes posteriorly is the posterior interventricular artery, and one that runs marginally, which is called the marginal artery, supplying the lateral aspect. So here, the marginal artery supplies the lateral aspect of the right side of the heart, while the posterior interventricular artery runs to the apex of the heart and supplies the posterior ventricular walls. Posterior ventricular walls. Remember that we said before that the posterior wall of the left ventricle is supplied by the circumflex artery. But this posterior interventricular artery does not supply only the right ventricular wall posteriorly. It supplies both ventricles. You know, it supplies the posterior aspect of both ventricular walls. So it gives a better supply than this circumflex artery. So this posterior interventricular artery gives a better supply than the circumflex artery. So quickly, let's run through it again. So here we have right coronary artery and left coronary artery, both originating from the base of the aorta, okay? And then the left coronary artery forms the circumflex artery, gives rise to the circumflex artery, and the left anterior descending artery, or what you call the anterior interventricular artery. This circumflex artery, as you can see, is going posteriorly, okay? So it supplies this left atrium and also supplies part of the left ventricle. You see a branch going to this left ventricle posteriorly, okay? And then we have, and a part of it also comes here to form an anastomosis here, okay? Now, the anterior interventricular artery is also supplying the posterior part of the left ventricular wall. On the right side, we have the right coronary artery, give two main branches. One runs posteriorly, which is called the posterior interventricular artery, and then another one runs marginally, which is called the marginal artery. So the marginal artery is supplying the lateral aspect of the right side of the heart, while the posterior interventricular artery goes to supply the walls of these two ventricles posteriorly. You can see that a branch of this one that comes here came down to the apex of the heart and also supplies the apex of the heart. Good. Now, near the apex of the heart, this artery merges or anastomosis with the anterior interventricular artery. So you see that there is anastomosis between the the right coronary artery and this anterior interventricular artery from the left coronary artery. So this is the anastomosis here. You see there is one anastomosis here and there is another anastomosis here. A part from the right artery and another part from the left artery come to form an anastomosis. Together, the branches of the right coronary artery supply the right atrium and nearly all the right ventricle. The branches of the right coronary artery supply the right atrium and nearly all the right ventricle. So this is very simple. If it's the right coronary artery, then it is supplying the right atrium. Remember that. If it is the left coronary artery, it is supplying the left atrium. But for the ventricle, the left coronary artery gave a branch, this one, that comes to supply the interventricular septum and the anterior wall of both ventricles, not only the left ventricle. It goes to supply both ventricles, but on the anterior side. While this one, this posterior interventricular artery, goes to supply both ventricles also, but on the posterior side. So there is a balance. Now the balance is that the left coronary artery gave a branch that supplies both ventricles anteriorly, while the right coronary artery gave a branch that supplies both ventricles posteriorly. And then the right coronary artery, can you still hear me?
Yes, sir.
Good. And then the right coronary artery supplies also the right atrium, while the left coronary artery supplies the left atrium. Good. So this is another diagram showing you the origin and the different branches of the coronary artery. Here, they originate the right coronary artery, the left coronary artery. Left coronary artery gives the circumflex branch, which runs posteriorly, and this anterior interventricular artery, or the left anterior descending artery. And on the right side, we have the right coronary artery, which gives this branch that comes to anastomose here, which is the posterior interventricular artery, and then this marginal artery, the right marginal artery. Good. And let's look at the coronary veins. So the coronary veins, after passing through now we said the coronary veins drain blood, okay, from the heart. Yeah, the arteries supply the heart, but I said it's better to call them cardiac veins because they are not called coronary veins, they're actually called cardiac veins. So another name for coronary veins is cardiac vein. After passing through the capillary bed of the myocardium, the venous blood is collected by the cardiac veins, whose path roughly follow those of the coronary artery. So the cardiac veins are running side by side with the coronary arteries. Now these veins join to form an enlarged vessel, which is called the coronary sinus. So there's a large vessel called the coronary sinus, which is a combination of the different veins, which empties the blood into the right atrium. So we said that cardiac veins return blood to the heart and the blood goes to the right atrium. But all of the veins join together to form a coronary sinus. And the coronary sinus now takes that blood into the right atrium around the superior vena cava. So the coronary sinus is obvious on the posterior aspect of the heart. So this is it here. This is the coronary sinus. You see that the size is bigger than all these other smaller veins. Why? Because these smaller veins, they all drain into this one, into this large one. They all drain into this one to form a large coronary sinus. Now the sinus has three large tributaries. So the tributaries are the smaller veins that come together to form the coronary sinus. So what are the three large tributaries? They are the great cardiac vein in the anterior interventricular sulcus. So this is it. This is the great cardiac vein in the anterior interventricular sulcus. This is the great cardiac vein. So it drains also into the coronary sinus. And then you have the middle cardiac vein, which is this one here. This is the middle cardiac vein. And it also drains into the coronary sinus. And then you have the small cardiac vein. So this is the small cardiac vein. The small cardiac vein also drains into the coronary sinus. So it is this coronary sinus that now takes the blood to the right atrium. But there's an additional artery which is called vein. There's an additional vein which are called anterior cardiac veins that are scattered around the anterior wall of the heart. So these are the anterior cardiac veins, and they empty directly into the right atrium. Now, look at the difference. These anterior cardiac veins do not drain into the coronary sinus. They go directly to the right atrium. They empty directly into the right atrium. But the coronary sinus has three tributaries that drain into it. They are the great cardiac vein, the middle cardiac vein, and the small cardiac vein. But these anterior cardiac veins, they drain directly to the right atrium. They don't drain into the coronary sulcus. So remember, they don't drain into the coronary sinus. So remember that, okay? Good. Now, let's see another slide. So this slide is just a repetition of what we've already discussed, but let's look at, maybe we can have a better diagram. You can see here that the arteries are running side by side the veins, like I told you. So you see a red and you see blue, they're running side by side. So this is anterior interventricular artery, and you see the vein running alongside it, which is this vein here, this great cardiac vein running alongside it. So the same thing will happen on the right side. So blood circulation to the heart muscles is called the coronary circulation, and it happens through the coronary vessels. We said we have the arterial supply, which has two coronary arteries, the right coronary artery and the left coronary arteries. And both arteries arise from the roots of the ascending aorta. So this is the ascending aorta, and the root of the ascending aorta is here. That is where both arteries arise from, right and the left. Okay, the left one runs behind this pulmonary trunk here. Okay. Now let's look at the next slide. Now the right coronary artery, this slide is describing the course. So it traverses in the right AV sulcus, and it gives a marginal branch. So it's simply telling you how it forms the marginal branch, which we talked about. So this is the marginal branch. So it runs through this sulcus and comes here and forms the marginal branch, and then runs to the posterior side and continues at the posterior interventricular artery. The right coronary artery begins from the base or the roots of this ascending aorta, and then runs through this sulcus, gives a marginal branch, and then also goes to give a posterior interventricular branch, which comes down here. Okay. Now, the areas that are supplied by the right coronary artery, we already said that the right coronary artery will supply the right atrium, a greater part of the right ventricle, because it is the right coronary artery. It will supply a greater part. You could see that all of these branches that come from it are supplying the right side. The greater part of the right coronary artery is of the right ventricle. The greater part of the right ventricle is supplied by the right coronary artery. So these are the branches that come from it. And then it supplies the small parts of the left ventricle. Why? Because it runs down this way also to come towards the left ventricle. And then it supplies the posterior part of the interventricular septum, which we already said here, and the major portion of the conducting system, including the SA node. So I told you before that the SA node is called the sinoatrial node, which is the main pacemaker of the heart. I'm going to teach you that in physiology when we looked at the electrical activity of the heart, how the heart is able to generate its impulse and conduction of impulses from one part of the heart to another. So that pacemaker, or the SA node, is supplied by the right coronary artery. So don't forget that. Right atrium, greater part of right ventricle, smaller part of left ventricle, posterior part of interventricular septum, and then a major portion of the conducting system of the heart. So the conducting system of the heart will have the SA node, will have the AV node, and we have the what we call the bundle of His, and then we have the Purkinje fibers, which we'll talk about later in physiology. And most of them are supplied by the right coronary artery. Now, the left coronary artery. The left coronary artery divides into two main branches, which we said are the anterior descending branch or the anterior interventricular artery, which is another name for it, reaches the apex of the heart and gives many septal branches. And then the second branch of the left coronary artery is the left circumflex branch, which runs in the AV groove and proceeds as posterior descending branch, which we already mentioned here, this one coming down here. Okay, and then sorry, this is the circumflex branch going this way, and then this is the left anterior descending branch or the anterior interventricular branch. Good. So what areas are supplied by the left coronary artery? The left coronary artery, as we said before, will supply the left atrium, a greater part of the left ventricle. This is the left ventricle. So a greater part of the left ventricle is supplied by the left coronary artery. And the left atrium also is supplied by the left coronary artery. And then a small part of the right ventricle is supplied also because of the circumflex branch that comes down to anastomose here. And then we also have the anterior part of the interventricular septum is supplied by the left coronary artery, and then part of the bundle of His. So the bundle of His separates into two parts. We have a right bundle and a left bundle. So that's left bundle branch of this bundle of His is supplied by the left coronary artery. But don't worry yourself, I'll teach you about the bundle of His and the conducting system later in physiology. Good. Now, the coronary circulation, what happens? Normally, coronary arteries do not overlap in supply. So the arteries do not overlap each other in supply, but they form functional anastomosis, which becomes active in ischemic heart disease. So why do we need to form a functional anastomosis? What is the essence of an anastomosis? Now, I'm going to take you back to this diagram. So in this diagram, we saw an anastomosis. Yeah, we saw anastomosis between this branch of the right coronary artery and the branch of the left coronary artery, or the circumflex branch. So why do we have this anastomosis? Now, imagine that there is an occlusion of this blood vessel, this particular blood vessel here, this left anterior descending that is coming here. Imagine that there is an occlusion, maybe there is atherosclerosis, and this blood vessel is blocked. And because it's blocked, it means that this part of the heart might not receive blood because it is blocked. But because of this anastomosis that happened here, the heart, this part of the heart can still receive blood supply, even though this main branch has been blocked, okay? But again, it depends on where the obstruction is. If there is an obstruction to this blood vessel here at this point, this anastomosis might not have any effect, because once you block here, blood cannot even reach anywhere, because what is forming this anastomosis was a branch from this one that came down here. So if I block here, if there's a block here, it means that blood cannot even get here. So there will be no blood in this anastomosis. There cannot be an anastomosis. But imagine that there is a block in this one that is coming down here. If this one is blocked, blood can still reach this part. Why? Because of this one that came back here to form an anastomosis. So the essence of an anastomosis is to help the heart still receive blood supply if one of the blood vessels is obstructed. So if there is an obstruction, maybe there is a blood clot in the blood vessel, or there is atherosclerosis of one of those blood vessels, you could still get blood supply to a portion of the heart. So that is the essence of an anastomosis. So still, functional anastomosis is present, which becomes active in ischemic heart disease. So in ischemic heart disease, a branch of this coronary artery is blocked. And once that branch is blocked, blood will no longer get to that part of the heart, if not for the anastomosis. So two types of anastomosis we have. So we have what we call cardiac anastomosis, where coronary arteries and arteries, or coronary arteries and veins. So you could have an anastomosis between the coronary arteries and another artery, or you could have an anastomosis between a coronary artery and a vein, a cardiac vein. That is called a cardiac anastomosis. Then we have an extra cardiac anastomosis. Extra cardiac anastomosis is anastomosis between the coronary artery and vessels outside the heart. Remember, cardiac anastomosis is between blood vessels in the heart. So if I have a coronary artery combining with another branch of a coronary artery, it is called cardiac anastomosis. If I have coronary artery combining with a vein, it is called a cardiac anastomosis, but this is the cardiac vein, so it's called cardiac anastomosis. But if I have a coronary artery combining with pulmonary artery, for example, that will be an extra cardiac anastomosis, because we've gone out of the heart to form an anastomosis. So a coronary artery is now joining with a pulmonary artery. So this is now heart and lungs forming an anastomosis. So that is called an extra cardiac anastomosis. So don't forget, two types: cardiac anastomosis between vessels in the heart, and then extra cardiac anastomosis between one vessel from the heart and another vessel outside the heart. Good. Now, this is the venous drainage we already talked about before. So the venous drainage is by three types of veins. The large vein we call the coronary sinus, okay, coronary sinus. And this coronary sinus, we said, drains blood from the great cardiac vein, the middle cardiac vein, and the small cardiac vein. And the coronary sinus drains into the right atrium. And it is the largest vein, draining 75% of coronary flow. And then we said we also have the anterior coronary veins, which do not drain into the coronary sinus. They drain directly, into the right atrium. So they drain the right part of the heart and goes straight into the right atrium. And then here we have the vena cordis minima. Now, these are small, very small blood vessels that drain the myocardium, into in the chambers of the myocardium. So they drain blood from the myocardium into the right atrium. But these vessels are very small, very, very small. That's why they are called vena cordis minima. So minima means minimum, very small blood vessels, or they are also called Debeshan veins. So another name for these vena cordis minima are called Debeshan veins. So this diagram just shows the venous drainage, which we already talked about before. Middle cardiac vein, small cardiac vein, and great cardiac vein, all draining into the coronary sinus. And then we also have the anterior cardiac veins, which are not labeled here, draining into the right atrium. Now, the normal coronary blood flow, what volume of blood passes through the coronary vessels or the coronary arteries in 1 minute? You have about 200 milliliters to 250 milliliters of blood passing through the coronary arteries in 1 minute. And this forms about 4 to 5% of the total cardiac output. Now, remember, I'm going to teach you this later, that the cardiac output of the heart in 1 minute, the cardiac output is the volume of blood that is pumped from the heart, okay, from the left ventricle. So when the left ventricle pumps blood into the aorta, in 1 minute, 5 liters of blood is pumped. 5 liters of blood is pumped in 1 minute. So cardiac output per minute is 5 liters. Now, 5%, 4 to 5% of that 5 liters goes into the coronary circulation. Remember that the blood leaving the aorta, we said we have the ascending aorta, and then we'll have the aortic arch, and then we'll have the descending aorta, which from the abdominal aorta. But we said that the blood from the aorta supplies all the parts of the body above the heart, and then comes down also to supply all the organs below the heart. But 5% of that blood enters the coronary circulation. So out of 5 liters of blood that is pumped from the heart in 1 minute, 5% of that 5 liters enters the coronary circulation. They don't go to the systemic circulation. You remember systemic circulation and pulmonary circulation. But the systemic circulation, the blood is leaving the left ventricle through the aorta. Now, that blood in 1 minute is 5 liters of it is pumped out by the heart. But out of that 5 liters, 250 mils goes to the coronary circulation, okay? While the remaining 95% of that 5 liters goes into the systemic circulation. So it means that the heart takes back 5% of the cardiac output for it to be able to function. So the essence of coronary circulation is so that the heart can function. So the heart pumps out all the blood into the aorta, but 5% of it enters the right coronary artery and the left coronary artery, and then form the coronary circulation. And if you do 5% of 5 liters, you will get 250 mils of blood per minute passing through the coronary blood vessels. Now here, this is not so important, but this is how to measure the coronary blood flow. There are different methods using the nitrous oxide technique and the Doppler flow meter. You will do this later in higher courses. And then we'll have what is called the coronary angiography. So that will show you if blood is passing through the blood vessel, the coronary vessels, or if they are blocked. When you start doing, I think you will do surgery in higher classes. And when you start doing cardiology also, you'll be taught more about coronary angiography. So they just inject a nucleotide, a colored nucleotide, into the coronary vessels to see if blood is passing through. If blood is not passing through, you would know. So this is how you measure coronary blood vessels, blood flow. And once there is an obstruction of coronary blood flow, it means that the blood vessel has been occluded. There's an obstruction blocking the blood flow. Now, the coronary blood flow happens in different phases. There are different phasic changes of coronary blood flow, depending on the compression of the cardiac muscles. Now, the muscles of the heart are the cardiac muscles. What happens is that when blood flows through the coronary arteries, the blood flow is not constant. There's a time where there's an increase in blood flow through the coronary artery, and there's a time where there's a decrease in blood flow through the coronary artery. But what determines that is the compression or the contraction of the coronary vessels. Now, coronary blood flow decreases during systole. So systole is when the heart chambers are contracting. when the heart chambers are contracting, they are trying to pump blood out of the heart. At that time, blood flow in the coronary vessels is decreased. Then, when the heart muscles are relaxed, they are relaxed in diastole. In diastole, the heart muscles are relaxed, blood flow is increased to the coronary circulation. So I say that again. During systole, the arteries are compressed. Why? Because during systole, the muscles of the heart are contracted. And once they are contracted, the coronary artery is compressed and only small amount of blood flows through the coronary vessels. While during diastole, there is relaxation. So this compression is released means relaxation. So the heart muscles are relaxed and there is increased blood flow into the coronary vessels. So remember, anytime the heart muscles are contracting, it is systole. When the heart muscles are relaxed, it is diastole. I'll still teach you cardiac circle later. Now, so in systole, heart muscles are contracted, and because they are contracted, they compress the blood vessels, decreasing blood flow in the coronary artery, while during relaxation of the heart muscles, blood flow increases, so the coronary circulation. Now, an increase in aortic pressure leads to an increase in coronary blood flow. So when the blood pressure in the aorta increases, there is an increase in the coronary blood flow. Blood pressure in aorta is increased because there was already an ejection of blood from the ventricles of the heart. So there's already systole, and that is why aortic pressure increases, and then there will be an increased blood flow to the coronary vessels. So this diagram, this graph here is just showing you coronary blood flow. You see that in systole, there is a decrease in coronary blood flow, and then in diastole, there is an increase in coronary blood flow. In the next circle, and in another systole, there will be a decrease, and in another diastole, there will be an increase in coronary blood flow. So that's what happens. Now, blood flow in individual ventricles. So in the left ventricle is the most powerful pump of the heart. Why? Because that is where the blood enters the aorta. The aorta is the largest artery. You know, we have the two ventricles, the left and the right. The right one just pumps blood into the pulmonary artery, but the left one is pumping blood into the aorta, which is the large artery. So the muscles in the left ventricle are bulkier, thicker, more than that in the right ventricle. So we have a stronger pump on the left ventricle. Now, during the onset of contraction, blood flow sharply declines due to myocardial pressure and a decrease in aortic pressure at the beginning of the systole. This is what happens in the left ventricle. Now, during the ejection phase, when the blood is now pushed out of the left ventricle, the aortic pressure increases and the coronary flow remains less. Now, during onset of diastole, blood flow increases due to a decrease in myocardial pressure. Why? Because we said in diastole, there is relaxation of the heart. So myocardial pressure is low, and that increases blood flow to it. So the same thing we already explained before. Now, on the right ventricle, some blood flow occurs as the force of contraction is not as severe as in the left ventricle. I just told you that the right ventricle is not as strong a pump as the left ventricle. So even when there is contraction in the right ventricle, there will still be a small amount of blood flow to the right, to the coronary vessels. But on the left side, because of the force of contraction, there is no blood flow. There's a decrease in blood flow in the coronary vessels on the left side. But on the right side, the pump is not that forceful, and so you could still have a small amount of blood flow occurring in the coronary vessels on the right side. Now, regulation of coronary vessel. What regulates the coronary vessel? So the coronary circulation has what we call an auto-regulation, so it can regulate itself. So coronary blood flow is mainly dependent on vascular response. It is regulated by the following factors. One, oxygen demand. So the most important factor of coronary blood flow is oxygen demand. Anytime your body is in need of oxygen, if there is a high oxygen demand, it means that your heart needs to work faster, needs to pump more blood. So at that time, there will be an increased coronary blood flow. So 70 to 80% of oxygen is absorbed from the blood. And then we have metabolic factors. There are some metabolic products which are produced. Examples will have adenosine, potassium ion, hydrogen ion, carbonate ion. Now, these products are produced during hypoxia. Hypoxia means there is decreased oxygen. You are not getting enough oxygen. So at that time, your blood vessels will dilate. So there is vasodilation, which is caused by metabolic products. Your blood vessel is dilating so that more blood can flow to your different organs because your body is suffering. There's hypoxia. These tissues are not getting enough oxygen. So blood vessels will dilate so that more blood can go to your tissues. So these metabolic factors increases coronary, they regulate coronary blood flow also. And then there's a neural regulation where nerves, because the coronary vessels have autonomic innervation. We will do autonomic innervation later when we talk about the sympathetic and parasympathetic nervous system. So epinephrine or norepinephrine increases or decreases blood flow. So it depends on which innervation. If you have autonomic innervation or you have if you have sympathetic innervation or parasympathetic innervation. But we'll talk about all of that later. And then there's an indirect effect where there's sympathetic stimulation causing increase in cardiac activity and causing increase in metabolic products, resulting in vasodilation. And the opposite will happen if there is a decrease or if there's an obstruction of sympathetic circulation. But this is something a bit higher for you. We'll talk about that later. So the last thing we'll look at is applied physiology, clinical aspects of the coronary vessel. What will happen if there is an obstruction or an occlusion of the coronary vessels? So coronary occlusion, it is the obstruction of the coronary arteries due to what we call atherosclerosis, which I'm going to teach later. So atherosclerosis occurs due to deposition of cholesterol. So when you take excess cholesterol and eat a lot of fat, it will cause what is called an atherosclerotic plaque. So this plaque can block the blood vessel. Now look at this. Look at this diagram here. Can you see this place here, circled? Notice that this whole part is white. Why is it white? Because blood is not coming to this part of the heart. Blood is not coming here because there is an atherosclerotic plaque here, blocking a branch of this left coronary artery. So this is the left anterior descending artery. There's an obstruction at this point. So because of that, blood is not reaching this part of the heart. And you will see the part of the heart has a different color because it is suffering from what we call ischemia. Blood is not reaching it. And this can lead to what we call necrosis of the heart. which I'm going to teach you later also, necrosis of the heart. So coronary obstruction is caused by cholesterol, excess cholesterol, which forms atherosclerotic plaque. And this plaque is common near to the aorta, and it can obstruct 3/4 of the lumen. If it blocks 3/4 of the lumen, or the opening of the blood vessel, it will lead to what we call myocardial ischemia. Now, if it's only maybe 1/4 of the lumen is blocked, you might not suffer myocardial ischemia. But when you have 3 out of 4 parts of the pipe or the lumen of the blood vessel is blocked, then you will have myocardial ischemia. So ischemia simply means lack of blood supply. So here, this white part shows that blood is not reaching this part of the heart. Then we have what we call the myocardial infarction. So muscles become unable to sustain cardiac muscle function. When there is myocardial ischemia and these muscles here, myocardium, or these muscles here, these cardiac muscles here, undergo what we call an infarction. There is necrosis. They can no longer function because they are not getting oxygen, they are not getting nutrients. They begin to die. The cells here begin to die. And then we have what we call a myocardial infarction. And that part of the heart can no longer function because blood is not reaching it due to an obstruction of the coronary artery. But the myocardial infarction will depend on which part of the coronary circulation is blocked. Okay? Remember, the most important part of the heart is the left ventricle. That is the main pump. So any block to this left coronary artery is going to be very dangerous. It's going to lead to, and again, remember that this left part needs more nutrients and more energy because it does more work. And so any infarction or any obstruction you have there, if there's an ischemia of this part, is going to be very dangerous. And the heart will have what we call a cardiac shock. So blood will no longer reach that part of the heart. We have what we call the angina pectoris. So angina pectoris is the pain you feel due to myocardial ischemia. When blood is not reaching a part of your heart, it leads to pain. So you begin to feel pain in your heart, and that pain is a hot, pressing, or constricting pain. And you see a lot of people say, oh, my chest, the left part of my heart is paining me. I'm feeling a compressing or a constricting pain. They are either having what we call an angina pectoris. And that pain sometimes could radiate to the left arm. So you are not feeling the pain only in the left part of the chest. It could go to the left arm and the shoulders. And sometimes it could even radiate to the back. So any pain you feel on your chest, on your the left part of your chest that radiates to the left arm, to the shoulder, and to the back is a sign of angina pectoris or a myocardial infarction. An angina pectoris, angina is simply like pain. Pectoris just means the pectoral or the heart region, the chest region, okay? So any pain you feel in your chest will be an angina pectoris if it is caused by an ischemia, a lack of blood supply to that part of the heart. And there are different types of angina pectoris, which I will teach you later. Maybe in physiology, we'll do the type of angina pectoris that we have. Now, how do you treat angina pectoris? With drugs. What type of drugs? To use vasodilators. So vasodilators, they try to dilate or expand the lumen of the blood vessel. Remember we said that the clots, atherosclerosis, blocks the lumen of the blood vessel. So now you need to open up that lumen by taking drugs we call vasodilators. And these vasodilators, examples are nitroglycerin. So nitroglycerin or any other nitrate drug can be used to treat a patient with angina pectoris. Now, when the patient is feeling chest pain and that chest pain is relieved by nitroglycerin, then the patient has angina pectoris. But if after taking nitroglycerin, the pain does not stop, then it is no longer angina pectoris, it is the myocardial infarction. Although there are other tests you would do to prove that it is myocardial infarction. But anytime a patient has pain in the chest that is due to ischemia or lack of blood supply to that part of the heart, and that pain cannot be solved, cannot be relieved by nitroglycerin, then it is no longer angina pectoris, it is a myocardial infarction. So an infarction is a more serious condition than angina pectoris. Now, other drugs that you use to treat angina pectoris is, and myocardial infarction, of course, is beta blockers. In pharmacology, you will learn about beta blockers. They block the B1 receptors of the heart, preventing sympathetic enhancement of the heart rate. So they try to reduce the workload of the heart since enough blood is not getting there. Another way you could treat coronary artery disease is what we call aortic coronary bypass graft surgery, which I'm going to teach you later, and what we call coronary angioplasty, where you put a catheter or a balloon in that blood vessel that is blocked to kind of expand the blood vessel so that more blood can flow through it. And that is what the diagram here is showing. And sometimes you could use a laser beam to dissolve the occlusion. So you take a laser beam and beam it towards the occlusion to dissolve that obstruction so that blood flow can return again to the portion of the heart. So this is coronary circulation. It's a very interesting lecture, but it's a bit broad. But what I want you to know is just the branches of the coronary artery, the right coronary artery and the left coronary artery, and the branches each of them give. On the left side, we have the circumflex artery and the left anterior descending artery. And then on the right side, we have the right coronary artery, which forms the right marginal artery, and the posterior interventricular artery. So these are the main arteries you should not forget. And then the veins also, the great cardiac vein, the anterior cardiac vein, the middle cardiac vein, and the small cardiac vein that drain into the coronary sinus, except the anterior cardiac vein, and they all drain back into the right atrium. Any obstruction to these blood vessels, this arterial supply, will lead to what we call angina pectoris or a myocardial infarction, depending on the level of obstruction. So that is all you need to know about the coronary circulation. Is there any question?
No, sir.
No question. So I'm going to ask you in the next class to list the branches of the coronary artery, tell me where they originate from and where they supply, and tell me about the veins, the cardiac veins that drain the heart, and you will tell me what would happen if there is atherosclerosis or if there's an obstruction of any of the branches of the coronary artery. And then you will tell me also the importance of anastomosis. Why do we need to have an anastomosis? Not only in the heart, but in the body. And then, yeah, basically that is all you need to know about coronary circulation. And don't forget that 5% of the cardiac output goes to the coronary circulation. And that 5% is about 250 milliliters of blood in 1 minute. So every 1 minute, your heart receives 250 milliliters of blood from the coronary circulation. Okay, that will be all for today. In the next class, we would do a quick revision of coronary circulation and then we'll look at other branches of the circulatory system, other blood vessels. Maybe we could look at blood supply to the heart, to the brain. We'll look at the arterial circle of Willis in the next lesson. Thank you very much. That will be all for today. Bye-bye.